usually what I say to people is, what is it you really want? What are you really looking for? Because it always is most important when there's a great match between what it is that gets them excited, what it is that they really want to get better at or they really want to lead in. And if we can make that connection and really help put them in a scenario that's the best match for them, then that's a win-win for us. So I try to push people a little bit to think about what's really important to them. Is research important to them? Is being an educator important to them? Is being a manager or a leader important to them? What is it they think they're good at? What do they want to get better at?
When saving lives is what you do, your standards are anything but standard. In fact, you set them higher than most to deliver results that patients can depend on. You refuse to compromise. We couldn't agree more. We are Edwards Life Sciences, and like you, we believe that good is never good enough. Rising to the challenge of today's TAVR patients isn't just a mission, it's a commitment. And because you set a higher standard, we set our sights on meeting you there. Welcome to the higher standard, your standard. Learn more at edwardstavr.com.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD from the Cleveland Clinic.
Hello, everyone. Welcome to another episode of Parallax. This is the second episode which we are bringing to all of our listeners in collaboration with the Heart Failure Society of America. The first one, which we recorded a few weeks ago, was with the editors-in-chief of the Journal of Cardiac Failure, which happens to be the official journal of the Heart Failure Society of America, with Drs. Mentz and Lala, Anu, and Rob, and was very well received. So this is just continuing with the same theme with which we've collaborated with HFSA, and that is the theme of diversity, equity, inclusion, and belonging. And my guest tonight, I say tonight, I'm sure you're listening to this in several different time zones, but for us locally in Northeast Ohio, it's late Monday evening. So my guest tonight is Dr. Albert. Dr. Nancy Albert is the immediate past president of the Heart Failure Society of America. In fact, she was just telling me that she just stepped down 2 weeks ago. So congratulations to her for, a stupendous role and for the position. Dr. Albert is also the Associate Chief Nursing Officer of Research and Innovation at the Nursing Institute at the Cleveland Clinic. She's a clinician nurse specialist in the George M. and Linda H. Kaufman Center for Heart Failure Treatment and Recovery at the Heart Vascular and Thoracic Institute at the Cleveland Clinic. And it is my absolute pleasure and honor to welcome Dr. Albert on the show. Dr. Albert, welcome, and thank you so much for doing this for us.
Thanks for having me. It's a great pleasure to be here.
So yes, well, congratulations, like I said, on your role as the immediate past president of a national society, which is, battling heart failure and trying to, supplant heart failure with heart function. I think kudos to, pioneers like yourself and Anu and Rob to sort of take the field forward and move it into the new space of heart function from heart failure, like Anu says. It really, everyone at Parallax, it's our honor to collaborate with HFSA on such an important topic of diversity, equity, inclusion, and belonging, which has garnered, I believe, a lot of focus, rightly so, and also a lot of momentum over the past year or so, or maybe over the past couple of years. So let me begin by asking you, in your role as the immediate past president of a national society which caters to such an important component of our lives as cardiologists, what were some of the So first off, how did the concept of DEI, as we call it, diversity, equity, inclusion, and belonging, come up in your meetings, in your vision statement for the year that you were at the helm at a national society like the HFSA? And what were some of the activities that you got the society involved in to promote DEI?
So it's a really great question. And I have to say that we think about diversity, equity, and inclusion, and it underlies everything we do. So we're always trying to be very careful to make sure that we are inclusive and that we do have belonging. We're a multidisciplinary organization, and as such, we have many different member groups, including patients, and we need to make sure that we're really meeting the needs of everybody. So to give you some examples of how we live DEI, in addition to having a policy, of course, and having a vision statement related to it, that, every aspect of the work we do, we consider diversity, equity, and inclusion. We think about it in many different ways. First, we think about it from a race standpoint, a gender standpoint, a career path standpoint. For example, some of our members are clinicians, some are researchers, some are educators, some are basic scientists. We also think about it from a career level standpoint. We have young investigators or early career members. We have very senior members, and we have mid-career members. And so we think about it from that angle. And again, because we're multidisciplinary, we have many different professions. I'm a registered nurse, but about 60% of our membership are physicians. We have other APP groups, pharmacists, for example, and physician's assistants. And so there's a lot to think about when we think about DEI from our organization standpoint. We have a leadership recruitment committee at Heart Failure Society of America, and once a year we put out a call for members to volunteer for many various committee roles, work group roles, and even board of director members and executive board members. And it's the work of the leadership recruitment committee to make sure they really consider DEI in all of its aspects when we're considering members. So for example, this year the board is 55% male, 45% female. We have multiple races on the committee. We have people who have different backgrounds on the board. We have 2 nurses, obviously multiple physicians. So you can kind of get a sense that we really try to live that multidisciplinary nature of the organization. I would say for anybody listening, if you're in heart failure or whatever organization you belong to, please volunteer, because in order for us to be able to live our mission and to be able to enhance belonging, we need to have people volunteer, because if they don't volunteer, then they're not at the table for us to make selections to be inclusive. We recognize also that when we put on our annual symposium, our annual scientific meeting, that we need to think about DEI and belonging in every aspect of that, from the panel that's selected for different sessions to every aspect. So we're always looking to really make sure that we're meeting the needs of our different membership and allowing those different voices to come forward. Another way, you already had Dr. Mentz and Lala's give a session on the journal, but we think about it when we look at publications as well. Again, we want to make sure that we're considering all the different nuances of heart failure and meeting the needs of our different multidisciplinary members. And so we wouldn't want the journal to just strictly have basic science or just strictly have topics of high importance to physicians who are looking for only cutting edge, innovative work. We know we've got a lot of nurses, we've got patients who are members, and we need to have a variety of papers that are published in this journal that meet the needs of early career as well as seniors and people who just want to get better at doing what they do day in and day out, as well as our more senior members who really have a strong background and are looking for that novel paper that it gives them food for thought and makes them think about where they're going to take the ideas to the next level. So I think when I think about the DEI aspect, education is a really important one. On the website, we have HFSA 365. It's a program that allows networking among members. And then we also offer a lot of education on our website. And again, we're trying to, in every way we can, meet the needs of our multiple different member groups, and also raise attention to the many variety of speakers that we have that are experts that may not be well known out there, but who are really experts in their own right. And so we try to bring in a lot of our early career people, have them get some attention to what they're capable of, as well as our very senior leaders who've been past presidents of the organization and who have led the charge of research, innovation, advocacy, etc., in the heart failure space for many, many years.
Excellent answer. You touched upon, several key issues, which, I want to parse out for, better understanding, not only for myself, but also for the listenership, those who are listening, particularly in the heart failure world, who want to, be more visible or, get more involved within the proceedings of the Heart Failure Society of America. If someone feels that he or she is from a background, that may not be conducive to, visibility in terms of, having the right connection or having the right mentor that can put a word in, or, just making the initial connection with someone who is at an influential position like yourself, being the immediate past president of the organization, or for example, me, I just had the privilege to make a connection with Dr. Starling, who then, put forth me in touch with, sort of the administration at HFSA for us to be able to do these series. But, for people who are not as privileged to have those kinds of connections within their organization and want to do something, want to volunteer, want to make themselves visible, want to participate, want to learn, want to grow, how do they, have that feeling that, we're not connected, we don't have mentors who are connected, we don't have the resources to reach to the higher ups in HFSA. What do you have to say to them, and how do you think you can circumvent this issue, which, I know for a fact is an issue? Because, even for example, with some of the other national organizations, I'm not talking about HFSA, but with some of the other organizations, I have personally experienced, such feelings about, this is just a niche club, and only people who have connections can actually, make themselves visible. So, it sounds like that HFSA has done a lot of, things in the right direction, in order to break these silos. And I thought this is an important question for me to ask, because, this may be the perception out there. And, how do you think you have mitigated and sort of tried to reverse this perception?
Yeah, it's a really good question. And there's always perceptions in any organization that it may be hard to get in the door. It may be hard to be seen or be heard. But one of the things that we've done is, we have a website, of course, and we've got this new HFSA 365. So anybody can go on at any time and raise their voice. They could raise a question. They could request to network with somebody. They can ask questions. For sure, they can let us know that they're interested in volunteering. So during the year, in my tenure as president, I received emails occasionally from people who said, "How do I get involved?" And when that happens, it's simply very easy to send their information over to the Leadership Recruitment Committee, and also to just remind the person that once a year we do a call for volunteer roles, and they need to submit their CV and let us know what they're interested in. Even if they don't get a position on a committee, because our committees are small. It's our belief that to have a really well-functioning committee, you can't have too many members. So most of our committees run with 7 to 11 members top. So it's not like there's 30 members on a committee and there's hundreds and hundreds of vacancies every year. But what we do say to people is, if we know what you're interested in, if something pops up, we need to have a work group. We need to develop some small group to get together and meet a special need, and they may disperse. It may not be a committee that's all year long. We'll go back into that volunteer pool and bring new members in. Because each of our committees have some early career members as well as some senior career members, there's always an opportunity for the early career people to listen, to learn, to watch, to observe, so that they can kind of see what happens and how that senior member jumps in, gives voice, isn't afraid to speak up, even if somebody says, I disagree with you. I think we should consider this. But that's the only way to get started, is to make a voice for yourself. At our annual meeting every year, we have a speed mentoring session, and it's so much fun. It's about an hour and a half long, and people who want to be mentored by experts in the field get 5 minutes in the chair, eyeball to eyeball with the expert. They could ask any questions they want. So they could say, how do I get published? How do I get on a speaker circuit? How do I get companies to recognize that I know what I'm talking about and I could be an expert consultant for them? They could ask anything at all, and that person gives them advice, and then a little bell rings and they go to the next table and the next table. They could ask the same question multiple times and get multiple points of view, and then leave with all of those points of view and figure out from themselves which point of view resonates best with them, which point of view is closest to their personality or their style of acting, so that they can make changes in their profession and grow and develop in it. So I would say that really we need people to raise their voice, let us know of their interest, and also be visible at things like speed mentoring, or if they see a call for something coming up on the website, to jump in and volunteer. Because it may be that when they do volunteer, they meet the right people, and it's those connections and the communication and collaboration that could really lead to future ventures. I'll give you a very brief example. It's not so much Heart Failure Society of America related, but many, many years ago, I was asked to be on a steering committee for a national research study. And at the time, I would say probably the rest of the committee were very high-level leaders in heart failure. Most of them did not know me very well, but after that 5-year period when I was on the steering committee, I was invited to another steering committee and another steering committee. So once you get started, if you're very active, if you're somebody who does show initiative and a willingness to raise your voice and give feedback and do the work behind the scenes, people will pay attention, they'll notice you, and it could make a wonderful marriage in terms of moving professionally or advancing professionally and meeting personal needs as well as professional needs.
Yeah, no, some really excellent tips there. So Dr. Albert, one question which, I just came up with as I was listening to you, and it's something that you actually brought up when we were just introducing each other. And that was, you being at the helm of a national organization and being a clinician and an advanced practice provider yourself. Have you seen other advanced practice providers approach you for, roles within the organization, for roles, in several committees that you described, and have they also approached you for mentorship, with regard to how do they move their career professionally to the next level? I'm sure you are, you are a shining example and a guiding light to so many advanced practice providers. So I'm just curious to know, because I know that other organizations, other national organizations have realized, all of us work very, very closely with our colleagues and advanced practice providers and know how vital they are to our daily functioning, in order for us to take care of our patients and for, establishing, teamwork. I know team of teams is the theme of the Cleveland Clinic.
Yes.
But, for me, I think what is really inspiring, to see your career and to see your role as the immediate past president is you being the beacon of such a vital workforce, for us within cardiovascular medicine. Would you agree? And I'm curious to learn from you how you've fostered and inspired the next generation of APPs.
Thanks again for asking that question. I would say that I've been very fortunate that because I do research and because I present nationally and internationally, I do often get the opportunity to meet many wonderful APPs out there who are interested in fostering their careers. They don't just want to go into work every day and go home. They really want to leave a legacy, or they want to feel that they've done something worthwhile and good for the betterment of their patients and for the betterment of society. And so they do ask questions about how they can get involved. Usually what I say to people is, what is it you really want? What are you really looking for? Because it always is most important when there's a great match between what it is that gets them excited, what it is that they really want to get better at or they really want to lead in. And if we can make that connection and really help put them in a scenario that's the best match for them, then that's a win-win for us. So I try to push people a little bit to think about what's really important to them. Is research important to them? Is being an educator important to them? Is being a manager or a leader important to them? What is it they think they're good at? What do they want to get better at? And so once I know that, then I could help steer them in the right direction. And sometimes it may be something at HFSA, but in other scenarios, it may be me calling them up in my regular work role and saying, hey, would you like to be a participant in this research study, a co-investigator? This will allow me to have multi-site study versus a single-site study. So for somebody who's interested in research, I'll drag them in that way. In many cases, this is maybe the first research study the person has done. They may never have published before. They may never have seen a proposal being written and gone through the process of IRB oversight, etc. So I would say that from the role standpoint, it's mostly about me listening and finding out what's really important to the colleague. And then when I have the capability and when I know that interest is there, I could try to make connections. It may be a connection through the organization. It may be a connection through a colleague who says, hey, Nancy, do you know somebody who's interested in doing XYZ? And I could say, I know the perfect person. And then when it comes to mentorship, I think mentorship takes on many different forms. A lot of the mentoring I do is lately in writing for publication, as an example. And so there's a lot of nurses out there that really want to be published, but they've never really been trained in how to write for publication. And so I do that often by being a reviewer, not an author, just a reviewer on their papers. I may spend 5 hours reviewing the paper, giving a ton of feedback to help somebody think about how to write in a way that's going to meet the needs of a typical editor of a journal so that they have a fighting chance of not getting a rejection, but instead getting a revise and resubmit. So I do spend quite a bit of time in that type of a mentorship role, and then also in the research side. But I would say overall, it's really based on what's important to that person. In my role as a leader at Cleveland Clinic, I get telephone calls and emails from many nurses who are fresh from getting a PhD in nursing, and they want to take a research track as an example, but they have no idea how to get started on that journey. They don't want to go to academia and be a faculty member and teach 100% of the time. And so they're not sure how to set up a career for themselves. So oftentimes I will have 1-hour conversations with people on the phone, usually in the evening, kind of like tonight, and just give them a chance to tell me what it is that's important to them, what it is they want to see themselves doing in 5 years. And then I could offer them advice about how to get from point A to point B. And usually I try to give more than just one piece of advice. I try to almost in a way give them parallel tracks so they could think about how to get there in multiple ways, and then they can figure out which works best for them.
Yeah, no, all of that sounds incredible and wonderful. And I'm sure that, people who you've spoken to and people who you've mentored are incredibly grateful and, thankful to the time that you've spent with them. When you were at the helm at HFSA, did you specifically invest in programs to, bring up careers in nursing? Knowing your background and knowing your interest in mentorship, has HFSA specifically, invented, for lack of a better word, programs for nursing mentorship? Because that's something which I perceive, and once again, this is a question that is just a natural extension to, what you just told us, is I don't think I've seen many other societies within the cardiovascular medicine space, develop programs specifically for nursing mentorship. And you've brought that up so eloquently and described it so vividly that this was just a natural extension to your answer. Was that something that you undertook when you were at the helm at HFSA?
So I was very careful when I was the president in this last year to make sure that I was trying to be to meet the needs of all members and didn't just target one group, whether it was nurses or young investigators or any single group. But previous to that, when I was on the board of directors, I found myself very often being the spokesperson for nursing. So if as you can imagine, the majority of the board of members are physicians, and oftentimes I'd be the ones mentioning either nurses. And to be honest, whenever I talk about nurses, I also talk about PharmDs, because they're the other group that may only have one board member that's a PharmD. And so I just want to make sure that the entire board constantly is aware that we've got other fractions or other groups of members that may not be in as big as numbers as physicians, but they have a really important role in their membership, and we need to meet their needs. The other thing is we have a nursing committee at HFSA, and it's a very long-standing committee. In fact, that was the very first committee I ever volunteered on when I first became a member, and I became a member shortly after the organization was started. The other thing that we've done, and we've really, I would say, escalated it in this last year with me as the president, is that we've worked really closely with the American Association of Heart Failure Nurses. So there's an association out there for nurses, many of whom are advanced practice nurses, and we've decided, as an example, to set up a pharmacy a course in the winter, so maybe in January or February of next year, to help nurses that are APPs who need to have a certain amount of contact hours or continuing education in pharmacy to maintain their pharmacy license. We try to do things with that organization so that we are being inclusive and making sure that we're meeting nurses' needs, and not just for HFSA, but also in a way to be reciprocal and meet the needs of AAHFN, which we kind of consider our sister organization. So I think there's a lot going on behind the scenes to raise nurses up in general and raise up advanced practice providers, again, PharmDs as well, and make them understand that they're not just wanted, but that we have programs and services that really are there to meet their needs, and give them that value for their membership.
Yeah, no, excellent. So, I mean, I'm assuming, I'm not a member of the HFSA. Perhaps I should be. I'm an interventional cardiologist, but Dr. Starling said that there is an interventional arm within HFSA because of how closely, interventionalists are now working with heart failure experts because of all the therapies that we have. But what I was going to ask you was specifically with regard to two groups. One would be, fellows in training, and then the other one would be early career. How do you think HFSA, specifically with regard to diversity, equity, inclusion, and belonging, have fostered deeper involvement from both these groups of people? Because I think a lot of the fellows in training, a lot of the advanced heart failure fellows, for example, a lot of the early career, really are looking for ways to contribute more than just clinical care, which, obviously, early career is such an important time in one's career because you have to focus on doing excellent clinical work, but at the same time, you're also brimming with new ideas, and you're brimming with the zeal to change the world, and you just want to be out there and sort of be the new face of heart function, heart failure, what have you. How has HFSA fostered deeper involvement from both these groups?
Yeah, so HFSA, again, has many committees. We do have an early career committee, and we don't have a fellows in training committee, but we have a lot of other committees that fellows who are in training may be interested in, whether it's a VAD, transplant committee, etc. And what we do is we really try to allow them to develop their own objectives and goals for the year based on the vision and mission and the strategic initiatives that the board of directors have put in place, and then to let us know what they want to do and how they want to go about it. So to give you an example, our early career committee had a very dedicated female physician who was an early career member, and she decided about 1.5 years ago that we ought to have a woman in heart failure committee because it's been long known that there's fewer women in heart failure and that they may feel marginalized compared to male counterparts in the field. And so she put in a request to have us start a Women in Heart Failure committee. For the first year, we made it a task force, and then it did so well, and they were so productive that we turned it into a full-fledged committee. And this year at our annual scientific meeting, we not only had a reception for women in heart failure, we also had a session that really focused on early career and women together. And so we had 4 speakers at that meeting. One was an APN. I was there to speak as the president. And then we had 2 other physician speakers as well. And so they all gave viewpoints about how to enhance your career, how to get ahead, what to consider, so that people that were in the audience could take the advice and help plan their own path for a career success. So that's just one example. But I would say that in general, HFSA really cares about listening to members' needs, issues, concerns. And so we do raise, when members bring ideas forward or bring comments forward, we do spend time talking about them to see how we can meet those needs, if we can meet the needs, how we can meet the needs. And again, we oftentimes give it right back to the people who asked and say, let's put a work group together and see if we could take this to the next level, and give the people who are making the request the opportunity to bring something forward in a more formalized manner.
Yeah, no, that's excellent. So maybe, this may be the last question, and then, I'll open for, dialogue and maybe, feedback or some of the closing comments from you. But in terms of, how does, in terms of supporting its members, how does HFSA support its members from varied backgrounds? I mean, I'm assuming there are, like you said, early career members, there are senior members, there are now women in heart failure, there are advanced practice providers. Please feel free to add if I've missed any particular group, which, is a major force within the organization. Because, and the reason I ask this question is that there are a lot of competing organizations which are vying for attention from the same group of, individuals, because we're all in cardiovascular medicine, and, we all have our niches and meetings, and we all have affiliations with various national organizations. So, in terms of its uniqueness to supporting its members, because I'm sure it's a closer knit community, which is always better in my opinion. But what are some of the unique aspects within HFSA, with regard to its membership and how it fosters career development for its members, within their respective institutions and also nationally?
Right. I would say that it's all about programs for us. We have an HFSA Learning Center, and in that Learning Center, there are many opportunities for any member, early career, somebody who's embarking on something new or different to get involved. We have a career center specifically for people that want to get information about maybe job opportunities, et cetera. We have an optimal medical therapy and heart failure certification program. That's really a program for people who are not heart failure experts, but really want to better understand how to optimize medical therapy, mainly pharmacologic therapy, but it could apply to CRT and ICD as well, so that they can do a better job of decreasing the burden of heart failure and improving patient outcomes. I think we've spent a lot of time in the last few years in publications and in sessions talking about the fact that we're not always doing the best job for our patients as possible. We know what drug classes we're supposed to be giving. We know what the target doses are. And yet when we look at real world big data studies, we see that we're not always quite there. So the Optimum Medical Therapy and Heart Failure Certificate Program is really meant to help the non-expert members who want to get better to have a recourse of learning so that they can any day, anytime, sit down, go through the different screens, be challenged to take little quizzes, and then show their evidence of knowledge. We also have a heart failure certification program. So as you probably know, the ABIM, the American Board of Internal Medicine, has a fellowship or a certification, for people who are VAD and transplant cardiologists. But for people that have their own practice, but they really don't focus on VADs or transplant. They send those patients to the academic medical center in maybe another city or down the road. We really wanted to have certification for them. So again, these may be people that feel like they're an expert, but they want to be able to show their expertise by showing that they are certified in heart failure. So you can see we've got many different forms of continuing education. We've got a certificate program to help people out. We've got a career center, a learning center. We also give out awards every year, and we've made a conscious decision while I was president and the president right before me, Dr. Beacom Boskirk, that we really need to increase the number of awards we give out every year because there's so many deserving heart failure team members that are members of HFSA who've done some wonderful things, but really haven't gotten the recognition they deserved. So this year we started with 4 new awards in addition to the awards we had previously. And next year they're going to escalate even further. So we made the decision this year to escalate for next year. And again, I think those are all ways that people can get some attention to their own career, help themselves with understanding and knowledge connect them to the right people. I mentioned the HFSA 365 in terms of networking and being able to contact somebody who's a leader in the field. For somebody who's a new or early career member, they're like, oh my God, Dr. Starling responded. That may be a very big deal to somebody. And so we do have a lot of very expert members who are willing to give back. And I'm always amazed at how welcoming and how knowledgeable and how willing many of our members are to share and to give back to our younger members. So I think it lies in the programs that we offer and the services that can really help move somebody along. I would say some organizations spend a lot of time at their annual meeting, and then they may have a lot of committees, but we never know how to get on the committee. We never know when the committees are being reformed. We never know how they make any decisions. I think with HFSA, we make it more open for people to understand what's going on, and we really do try to be as inclusive as we can.
Well, excellent. I'm sure some of the other national organizations have a lot to learn from, how things are organized at HFSA, and sounds like a wonderful organization. So congratulations to all that you've done to support its mission of diversity, equity, inclusion, and belonging. And, I can't thank Dr. Starling enough for making the connection. Any closing remarks, Dr. Albert, for the podcast and for our conversation and for the listenership at large, who are listening to our conversation tonight?
Yes, I think I think my biggest message is really, if you are somebody out there listening and you feel as though diversity, inclusion, equity, belonging are not really as embraced as much as you believe they should be, no matter where you work, no matter where it's happening, raise your voice, speak up, let people know. In many cases, it may be happening in a way that people don't even understand that their actions are incorrect. And again, at HFSA, we've put a lot of time and attention to being aware, to doing checks to make sure that we're really living our mission and our vision and our policy on DEI. But I think there's always room for growth and opportunity. And I would say that whether it's our organization or any group you belong to, or even in your workplace, raise your voice if you think there's an issue, because that's the only way that we can make change to be more inclusive and to really do a better job. Because in the end, when we are inclusive and we have equity, we all do a better job of meeting the needs of the patients we serve and also our own colleagues. And we see better growth. We see a greater facilitation of effort and community. And that's really important.
Excellent. Well, Dr. Albert, this has been a fantastic conversation. I've learned a lot about HFSA. I'm actually tempted to join as a member myself.
Please join. Yeah.
So, maybe I'll reach out to Dr. Starling and see if I could, be a member, even though I'm an interventional cardiologist and not a heart failure expert. But, I'll see what I can do to only enhance some of the visions and missions of your wonderful organization. But thanks again for spending some time with us late this evening. And I look forward to speaking to you soon.
Thanks so much for having me on. I really appreciated it.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.